So in the MOST study, this was a prospective longitudinal study for patients with ET, almost 1,200 patients with ET, followed now over several years with a median follow-up between 5 and 10 years. And looking specifically at that issue of progression from ET to overt post-ET myelofibrosis. With that, several factors were identified for the 53 out of the roughly 1,200 patients with ET that progressed, or roughly a little under 5% of the patients progressed. One, time. The issue of time is clearly a factor in that potential progression. And this matches with earlier data that I had been involved with earlier in my career from the long-term studies from Mayo Clinic, that it suggested 10 years or more as a factor for that progression from ET to myelofibrosis. Second, more anemia or higher white blood cell count at baseline. And again, I think selecting that there were patients that had a bit more aggressive phenotype, really even from their initial diagnosis. Now, one limitation of the MOST study is not everyone necessarily had serial bone marrows done as part of the study. So there's the possibility that there might have been within this group patients that would be under the WHO classification be called prefibrotic or early myelofibrosis. Now, in fairness, this has historically been a group that we largely have treated as ET. You know, back in the day before this was an identified subset, patients with ET kind of fit in this category. This is a category that we know has a risk of progression toward myelofibrosis. So I think it helps to further reinforce some of those prognostic factors that have been associated with ET with a greater likelihood of progressing to MF at some point in time versus those individuals with ET that have a low risk of progression.